Christy, thank you for joining me again today.
I'm glad to be here. Thank you.
We're going to be talking about diabetic neuropathy today. Mm-hmm. It's a subject we've covered a couple of times.
Yes.
But
it's just
there's
so prominent, though.
It is. Mm-hmm. It is, and actually becoming more and more prevalent out there. Mm-hmm. And there's still no easy, quick solution for it.
Right.
And more people are suffering with the effects of diabetic neuropathy. So it's something to bring back around again. And there's a ton of research on the effects of laser therapy and diabetic neuropathy. Improve our lighting a little bit there.
There we go.
Nice. So we're going to go into this study. This study is not a new study. A lot of times I'm covering studies from just the last year or two, you know. This is one, though, that's a really, really solid one that kind of laid some of the groundwork for some of the studies that are being done now. This is from back in 2012. It's not even old, you know, but...
Yeah. Relevant information still.
Yeah, absolutely.
It's early.
Is it? You've already been for a run and everything now, probably, haven't you?
Well...
Or did you take the day off?
I might take the day off.
Oh.
Yeah.
That's good.
So,
that's good.
But I was still up early.
Were you?
So, yeah.
Yeah. Well, let's get into this one. So this was published in the Journal of Advanced Research, sponsored by Cairo University in Egypt. The title of the article is Effect of Low-Level Laser Therapy on Neurovascular Function of Diabetic Peripheral Neuropathy. And we'll go through and we'll explain what all that means exactly. But basically, we're talking about diabetes and folks with diabetes who end up with painful nerve issues. Now, this is usually a burning and stinging sensation, and most of the time in the feet. Can happen in the hands as well. It's usually both feet equally, and it can get really pretty bad. It can keep people from being able to sleep. It can keep people from being able to walk normally, and there are other effects that go along with that too. So let me give you a little background information. If you're new to diabetic neuropathy, there's some things you should know. For one, the peripheral neuropathy that goes along with diabetes is the most common microvascular complication of both type 1 and type 2 diabetes. So microvascular, meaning the very smallest blood vessels are affected, right? And so that then complicates not only the nerves, but some other tissues as well that we'll touch on. Okay. So they say that diabetic neuropathy is thought to be progressive and irreversible. And that's never a fun thing to hear if you're dealing with, severe pain. Something that's going to get worse over time, that's progressive.
Right.
And that is irreversible. You can't get rid of it. I mean, it's pretty depressing.
It is.
Yeah.
It is.
So they say this happens as a consequence of peripheral nerve injury, and that is really sourced from microangiopathy. That just means pathology of the small vessels. The small vessels become non-functional, or they decline in function so much that they can't really supply good blood flow to these nerve endings. So they go on to say that this can lead to loss of the axons and axonal atrophy. That is the kind of the cord that leads to the of the nerve.
That long, yeah.
Not the ending, but the long
right.
part that comes from your back down to the feet. And that all the nerve fibers may be injured, but the small myelinated and unmyelinated fibers that conduct pain and temperature are the most affected. So when we talk about diabetic peripheral neuropathy, the nerves that are being damaged the most frequently, pain and temperature, which is why people end up with that burning and stinging and like pins and needles pain and numbness then too can occur. But it's nerve pain, so it's pretty significant. It can be pretty severe for a lot of people. How much really disturbance does it take to keep you from sleeping at night?
Usually doesn't take much, and I can't imagine the level that some deal with this.
Yeah, for some people it can be really severe. Thankfully not for everyone, but for a lot of people it can be really severe. They go on to say that not only does the nerve actually end up dying, but the repair mechanism of nerve regeneration is also affected and diminished to the point where it becomes completely defective. So you've probably heard that nerve damage is permanent, it lasts forever. We know that's not really true. We know that nerves can repair. We know that the body has mechanisms to regenerate nerves. But the problem with diabetic neuropathy is that the nerves become damaged and the repair mechanisms become damaged as well, to the point where those mechanisms no longer work to repair the nerves. And this happens over a long period of time. It's not an overnight thing. But most people with diabetes will have diabetic neuropathy. It's just a matter of time.
But there are things we can do to help but prolong the degree of degradation.
Yeah, absolutely. So if you're a diabetic, the best thing you can do is, what do you think?
Diet.
Yes. And
that's huge. Nutrition and exercise.
Absolutely. Diet and exercise, good nutrition, that's going to make more of a difference for your long-term outlook as a diabetic than anything else, than any medication, than any therapy, than any meditation, whatever. Diet and exercise together can make a massive change to this whole progressive disease. There are people who can actually reverse their diabetes if they get to it quickly and early enough.
Right.
So, understand that when we're talking about the rest of this that we're going to talk about today, and talking about laser therapy and exciting things like that, remember, the diet and exercise piece is massive. You have to do that. Absolutely have to do that.
Well, it's included in the whole process of treatment.
Right.
Right.
So the researchers go on to say that not only now do you have, the nerve damage, the nerve pain, and the repair mechanisms being actually damaged to the point they don't work, but also this disturbed microcirculation is responsible for the development of diabetic gangrene, ulcers, and infections of the skin and bone. And we've seen that as well. Diabetic ulcers that open up on the foot, they're non-healing, they end up becoming bone infections, and people have amputations. That is fairly common too, unfortunately.
Right.
And again, the best way to get ahead of that, diet and exercise. Okay. The longer your diabetes goes on, though, the more likely it is for these things to affect you. So if you're a newly diagnosed diabetic, you may not be dealing with any of this yet. Hopefully you never will. But if you can get ahead of it now, maybe you can stave a lot of this off. But realize if you are reckless with your diet, you do not exercise, you will go down this road. You will end up with permanent nerve pain, nerve damage, repair mechanisms that don't work, and things like infections and ulcerations, non-healing wounds.
Right.
Yeah. So take it seriously. If you're not already taking it seriously, which you probably are since you're listening to us, but take it very seriously and give yourself a pat on the back for doing well with your diet and your exercise.
Right.
That's an important thing too. Don't be too hard on yourself. Do your best. Do a good job of controlling your diet, controlling your sugars, getting out there and being active, because that has a big effect on where this will go.
Right.
Okay, I've beaten that one enough, right?
Yeah. Well, it's just so important. I mean, it's foundational. Really, from the start.
Yeah.
So.
It absolutely is.
But if we can prolong the bad side effects with that, it's just ideal.
Yeah.
So.
Yeah. Now, even if you've done a really good job of trying to control diet and exercise, or maybe it got away from you so fast that you didn't really realize what was happening, maybe you're dealing with diabetic pain, diabetic nerve pain at this point, you've probably been to the doctor, probably been to the neurologist, and they said, well, you have neuropathy. And then they said, try this medication. More than likely. That's about the only thing that goes on. They may talk to you about diet as well, but most of the time they just say, you have neuropathy, it's permanent, it gets worse over time, try this medication, it'll make it feel better. They say in this study, no more than 40 to 60% of patients show adequate symptomatic relief on the medications designed for nerve pain, which means that at least 40% of people that are put on medications are not going to feel good enough relief from those. They say, moreover, these drugs are frequently associated with central nervous system side effects, central nervous system being the brain, spinal cord, and they do not slow the progression of the underlying neuropathy. So it may make you feel better, it may make it easier for you to sleep, and those are good things, but
it's not doing anything for the issue.
Exactly.
Yeah.
Which is progressive. It means it's going to get worse over time.
Right.
So maybe it can make it feel better, but eventually it's going to get worse.
It's just a short-term cover-up. So.
Yep. So this particular study, again, was done in 2012. Let me tell you a little bit about it. They took 30 patients with diabetic neuropathy, long-standing type 2 diabetes, and with all these patients had symptoms in the legs and the feet for more than 6 months. So this has been going on for a long time. And everybody complained of burning pain and paresthesia in both legs. You know what paresthesia is?
I was going to ask you, what does paresthesia mean?
Yeah, it's nerve dysfunction.
Okay.
So numbness, tingling, that kind of thing. Yeah, just a fancy word for it.
Okay.
So they said that patients who did not have stable glycemic control were excluded from the study. Stable glycemic control being controlled sugars.
Yeah.
So if people were not watching their diet, they didn't even get in the study. And that is my first real takeaway here that I want to leave you with. If you're going to have something like laser therapy performed, if you're going to have that done, you have to have stable sugars. You know, you can't just be eating anything and everything. This is not, you know, laser therapy is a way to help your body recover. It is not an excuse to be able to go and eat whatever you want.
Right.
So you have to have stable sugars. Most of our LTI clinics won't even treat you if you don't have stable diabetic control. So, got to have that. Now, that doesn't mean you need to wait until you have everything perfect in your life to go get treated. That's just saying this is a critical factor. Have to have that under control. All right, so they took these 30 patients, they split them into two groups. Half of them got real laser, and half of them got the same procedure, but with the laser switched off. They didn't know it, right? And so they went ahead and measured their pain intensity, their peroneal and sural nerve conduction studies, which are nerves that go to the feet, and the foot skin microcirculation. So they took measurements of all these things. So not only the pain levels, but then also how well the nerves are working, how well the circulation is performing as well. And they looked at, they went ahead and set these people up for 12 treatments, so 3 times a week for 4 weeks, and then measured them, same measurements afterward as well. So whether they had real laser or fake laser, they went ahead and measured to determine, you know, is that something that was going to do any kind of difference or not. So 3 times a week, 4 weeks, they used a combination wavelength laser with 850 nanometers and 905 nanometers light at 10 watts. So it's a high power laser with 2 different wavelengths, which is typically what we see do best for neuropathy, high power multi-wavelength lasers. And they applied the laser to the lumbosacral area, or the low back area, kind of right across that belt line type area. And they also applied it to the whole bottom of the foot. So low back and then the bottom of both feet. Yep, exactly. And when they did that, it only takes about 10-15 minutes, depending on the laser that's being used, the exact technique that's being used. Doesn't take very long. It's totally comfortable. There were no side effects seen, no negative side effects seen at all. We know that non-invasive laser therapy does not really have any side effects.
Right.
We know it doesn't interact with any drugs or medications, so people can stay on supplements and medications that you're using in almost every case. And then the results that they saw were pretty phenomenal. So the skin microvascular circulation increased by 35.8% on average for everybody that got laser. It did not change at all in the sham laser group. So a 35.8% average improvement in skin circulation is a big change.
That's a big deal.
That is a big deal.
Yeah. Actually,
I have another quote on that here. Let me read that to you because they just really wanted it to stand out. So they said that this change, this remarkable finding may suggest that the skin of individuals with diabetes generates a response at that microvascular level. So not only stimulating the nerve, but actually changing the microvasculature of the foot so that it's healthier. So we start to work on these repair mechanisms. Because the next thing they saw is that they had a 26.4% reduction in pain on average. Wow. So some people were more than that, some people were a little less. Yeah. But 4 weeks of laser therapy resulted in a little more than 25% decrease in pain. 0% change for those in the control group that got fake laser.
That's not surprising, actually.
It's not. Yeah, that's because, about what we expect.
You know, you're increasing the blood flow, circulation. I mean, just in general terms, and so you can, with the light therapy, it's incredible and supportive with their findings.
Yeah, absolutely. So that's a big deal. So decrease in pain is a big deal, especially without use of drugs, use of any kind of surgery, anything like that. The fact that the skin microvasculature circulation improved that much is a big deal too. But also, when they measured the nerve function, there were some significant changes there. So the sural nerve, which is the sensory nerve really in the foot, it was dead in 73% of the patients that they started with before treatment. Okay, so 73% of all the participants, of all these 30 people, the sural nerve was just dead. No response on testing.
So basically no feeling.
Yeah.
Okay.
And in all the participants that had the fake laser, it remained that way. And the patients that had the actual laser, 100% of those patients had function return. If not to perfect, at least for a significant degree. So from dead nerve to live nerve, 100% of them, all 15, had good function return.
That's amazing.
That's a big deal.
That's a big deal. That's really encouraging.
Yes.
It's really encouraging for someone who's looking at something progressive and detrimental to, hey, there's hope.
Yeah. From the nerve being completely non-responsive and dead to every single one who had laser had improvements.
Yeah.
In waking that nerve back up, bringing it back to life. Yeah, it's a big deal.
Yeah.
Now the sural, so the sural nerve is that sensory nerve, right? The peroneal nerve is mainly a motor nerve, so strength. And everybody who had laser also had really good nerve function improvements in that one as well.
Nice.
Not quite as much as the sural nerve, but it's also a deeper nerve, and it's not as affected by diabetic neuropathy as the sural nerve is. So those sensory nerves, again, are the most affected by diabetic neuropathy. Still, good improvements there is pretty good too, because you can have return to strength, return to coordination, balance, things like that. It should be very, very helpful for people in a number of ways, because yeah, pain is probably what motivates these people to seek care, but there's a lot of other things that go on here too. Let me go back to one of the things I read initially. They said that in association with neuropathy, disturbed microcirculation is responsible for the development of diabetic gangrene, ulcers, and infections of the skin and bone. So if we're changing that, if we're changing and improving the microvascular circulation by over 35%, if we're improving nerve conduction in 100% of people who get laser, it's starting to head off some of these additional factors here, not just nerve pain.
Right. And this was just 4 weeks.
And this is just 4 weeks.
So if you're talking a little bit longer term treatment plan, there's incredible result potential.
Oh, absolutely.
And
absolutely.
then the person can get stronger and, with more movement and therapy and physical therapy,
absolutely,
getting stronger. It just is progressively in the different direction.
Yes, progressively better instead of progressively worse. Absolutely. Yeah, so it really does seem like this could change the whole track of somebody with diabetes and diabetic neuropathy. And obviously, the sooner you can get on this, the better. Not only on the diet and exercise side, but on the treatment side as well. So don't delay. It's definitely something to consider if you're dealing with diabetic neuropathy pain. It can be hard to find a good care center near you, so we can help you out with that. Go to our website, lasertherapyinstitute.org. You can find a clinic near you by clicking on the clinics tab. If you can find one of our member clinics, they will be equipped and ready to help you. And the results are quite good. We expect to see results at least this good over a period of 4 weeks or even less. And then, like you said, Christy, most people do go on for several more weeks of care as they start to come in less and less often, so that they can be stable and feeling better. And it changes the whole course of this disease. So definitely consider it. If you have a doctor in your area who does laser therapy but they don't know how to use it for neuropathy, have them get a hold of us. This is what we do. We help train doctors in how to do these things. We'll be happy to talk with them about what to do. Or if you have a doctor near you who's maybe thinking about doing laser, see if you can't connect them with us, because we can talk to them about how to make sure they get the right kind of equipment, the right settings, the training, and everything, so they can get it set up. They can start helping patients very rapidly. So, last point to leave people with here is to reiterate: control those sugars. Work on some level of exercise. Doesn't even have to be much, but just going for a walk can be really, really great. And then also remember, it took these folks 12 treatments over 4 weeks to see that 25-ish% reduce pain. Now, they probably started seeing it before then too, but still, it does take time. It's not overnight. Make sure you give it a chance. Give it time to work.
Well, it took time to develop. It's going to take time to reverse. Not reverse, but progressively get better.
Yeah, you're exactly right.
So,
Thanks for joining us today. We'll look forward to seeing you back here in the next week or two.
yeah. Thanks. Have a good day.